More now on our top story, the shocking death of Senator Lindsey Graham of South Carolina. There are still so many questions about how the very active 71-year-old could die so suddenly. Here's President Trump.
He called me last night. He just got back from Ukraine, and he had a great trip. He was telling me about the trip. He was pushing very, very hard. You probably know he wanted to do the Save America Act that he was talking about that. He was full of vim and vigor. He was tired. He said, "I'm tired," because it's a long trip. But other than that, he was fine.
He was fine, and a couple of hours later, he was dead. For more on the medical questions surrounding Graham's final hours, let's bring in Fox News senior medical analyst, Dr. Marc Siegel. Dr. Siegel, I want to put on the screen some information that the Wall Street Journal obtained from the emergency responders. At about 8:30 p.m., D.C. Fire and EMS responded to a report of chest pains at a home that was listed as his. Around 8:35, the crews arrived, but they said the deadbolt was secured and they would force entry and get help from police. Around 8:50, they said that CPR was in progress, but apparently, Doctor, it was already too late at that time.
Well, John, you know, for it to get from 8:30 to 8:50 to 8:55 is a long period of time if he's having a fatal arrhythmia at that time where the heart is no longer beating the right way or giving enough blood flow to the vital organs. Now, why would I think about that? Because we're talking about chest pain being reported. We're talking about the senator's father actually passed away at the age of 69 from a severe heart attack, and it definitely runs in families. He's in that age group where heart attack is most common, mid-60s to early 70s. That's the most common. And it's the most common cause of cardiac arrest is a heart attack. By far, out of the hospital, cardiac arrest usually comes from the coronary arteries being blocked, and they're tiny, and when they get blocked and the heart muscle's not getting enough oxygen, it goes into an arrhythmia where, again, you can get a cardiac arrest. So that scenario, I can't say for sure that's what happened, but that certainly fits it. You have a very, very short period of time where you could start CPR and get things moving again, but 20, 25 minutes is a long time.
He wrote about his father, FJ's medical history in his book, and here's part of what he said. He said, "When my father had a heart attack in his 50s, my mother sent me to the farm to live with my grandmother while he recuperated. And then later on, in his 60s, his father ultimately died at age 69. He says, Dr. Hunter arrived, too, and pronounced my father dead. He had had a massive heart attack, mercifully, while he slept, so he would not have experienced pain or fear in his last moments." Dr. Hunter thoughtfully took Darlene aside, that's Graham's sister, and explained to her that if she were blaming herself for not checking on Daddy sooner, she should stop. She wasn't in any way responsible for what had happened. "Your daddy's been coming to see me for years with heart problems," he told her, "and if I'd been right here by his side, I couldn't have saved him." So yes, doctor, there were heart issues in his family. I'm just guessing. I don't know, but I'm just guessing that the senator would have had his heart checked on regularly by a physician.
Yeah, I was going to say that next. And by the way, Darlene is a nurse, a great nurse. And Lindsey Graham adopted her and is a wonderful human being. This senator has done so much for this country and a very religious man. And as far as the medical part of this, look, we have cholesterol-lowering drugs now we didn't have before that are tremendous. We have the ability to look right at those coronary arteries with CAT scans now and MRIs that we didn't have then. We have, of course, stress tests and echoes. And I would assume as a senator he had all of that, you know, looking at him, but it doesn't always enough, because something like this can happen very suddenly, even with the best medical care.
What about the trip to Ukraine? He had just been in Ukraine. He was very eager to come back and report to the president, which he did, that he thought there was a path for peace there. But that is still a very long airplane flight. I don't know, probably 12 hours, maybe 13, something like that. Could that have played a part in this incident?
I'm glad you brought that up because, first of all, sitting for this prolonged period of time increases your risk of blood clots. a blood clot can actually be what happens to the coronary artery that causes the heart attack. Your oxygen content in the cabin is always lower than you think it is. That puts stress on the heart, and you're also more inclined to get dehydrated, which puts stress on the heart. So for sure, a long plane trip could have brought on angina, which is, again, blockages of the heart, the coronary arteries, which then leads to the heart attack. It definitely could have been a precipitating role. The president saying that he seemed okay on the phone is important because it shows that it was, again, emphasizing that this was something very sudden.
Fox News senior medical analyst, Dr. Marc Siegel. Dr. Siegel, thanks very much.
Thanks, John.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.